Today I'm going to work on the lower body of our beautiful model, Michelle. We're going to work on hip alignment and general leg alignment, trying to get those ankles and knees and hips all in the right line. So let's go ahead and get started. So to start Michelle off, I'm going to go ahead and just palpate and feel into her calves. Feel any differences between the right and the left. And maybe create just a little bit of traction and pull those calves towards me, which is going to tell me a little bit more about where she's tight and where she's more mobile. All right. Wake up this area. Most of this video will be on the tops and the anterior of the legs. So I want to make sure we give a little attention to the calves and get them warmed up. And also warm up the feet. Michelle does seem to have very strong feet. A little tight, so we might focus here today. It was very interesting. You can see her knees, they're very good alignment. There's a little bit of a discrepancy with the right side that kind of externally rotates out here, and the left side that's a little bit more straight on. It's interesting with rotations of the knee. They're usually in relationship to your ability to pronate and supinate your foot. So since Michelle has a little bit of tension in these arches and a lot of strength and muscular development, this leg is definitely much more aligned. And as you can see, she can pronate, she can supinate, and the knee goes properly. On the right side, I happen to know we have a little bit of restriction in the right hip from a past injury. So when I come in to warm up this foot and we go in, see the pronation, we have a little bit less ability to pronate in because this foot is already pronated to its max. It's her compensation pattern for the right hip. And then when we go out, now we can see, okay, cool, there's a little mobility there. So we know that her ability to plant into this arch, this ball of the foot, is what's keeping this knee out of alignment. That will also keep it hard to engage this medial part of the calf muscles. And it might actually create a lot of weakness or tension right in the inner hip region, right in here. Ultimately, the arches help support the psoas, support the spine. So if we have a bit of a pronation in there, we can expect the adductors and these medial support muscles to be influenced. That could lead to hip pain, and that could also lead to lower back pain. All right, but already you guys, I don't know if you can notice, but from up top, we already have this knee wanting to start aligning. So Michelle has a lot of cool physical therapy background and personal training. So her body's very responsive. And she can hear me speak as well, so her brain can be responsive too. It's very cool. Whenever I'm working on the hips and the leg alignment and structural alignment in the lower body like this, I'm really trying to align the ankles, the knees, and the hips. And if I can make it up to the rib cage, it's all the better. But my goal with the lower body is to align these 3 joints so they can support the spine properly. And so now you can see we actually did a little bit of work on this side, and I'm noticing some misalignments on the left coming in. So we'll start at the feet. If you feel tension in the fronts of the knees right here under the patella tendon, typically for me, that's a sign that the top of the foot is overworked. And you can get a lot of release by just putting some pressure in there, getting that part of the foot to wow. Pop, pop, pop. Getting that foot to mobilize. And the reason it's so helpful to work on the top of the feet is because the crease of the hip, the mobility of the hip, is dependent on the mobility of the foot. So if this foot has the ability to bend back and create a deep crease right here in the front, then the hips don't have to over-mobilize when you go down to squat, or when you go to walk, or when you go to do more complicated movements. If the foot stays the same, then the knees and the hips have to move more, and they don't get to be in the stable position they were meant to be. So the feet carry the most bones in one area in the entire body. If we restrict movement from this area, then we have to ask every other joint to compensate for that. And they may not be built for that type of compensation long term. So rub the tops of your feet. I also suggest rubbing the toes and getting to know them. They are very supportive of your psoas and your abdominal muscles. And we're quite disconnected from them. So it's nice to come in and just palpate them. That's a little bit of the opposite, where this right side felt a little bit more loose in the arch, or just not as able to ground or activate it. This side can activate it. It has a little bit more power. So I'm gonna go in a little gentler with more intention. And I'm just gently putting my thumb pressure right under the arch. It can be very intense, so I'm trying to gauge her pain response. All right. Now I feel like we can move up the front of the shin. This guy can also take the brink of our walking and running and overactivate. So it's nice to dig in there. You can do this on a ball. You can lean onto this area on a foam roller. Yes, it's intense, but yes, it affects the entire chain of connection in your body. All right. So I'm going to come under the knee to provide a little bit of support and get this bending just a bit. There we go. I feel a little tension here, and I want to create some slack in the calf so I can grab it. Get to the deeper muscles here. Calves can be intense. Just always remind your client, just let me know if the pressure is ever too much. And now I'm just going to petrissage and squeeze these medial calf muscles as well. And create a little traction. All right. Once again, I'm going to test her mobility here. She's got quite good spring. A little tension on the external rotation. But when you're working on the lower body as a whole, and you realize that there might be a hard or a challenging, it might be a challenge to engage this medial arch to adductors to psoas, and you know the compensation could be external rotation on the other side. This one falls in, this one falls out. It's our body's way of creating center. Now we'll go ahead and work the quads. Since we did a lot of work opening up the feet and the calves and the shins, the quads should be in a better position to be palpated, not as intense for the client. I'm feeling a little bit of tension in this hamstring. So I'm just tugging on the leg, figuring out where that is. And I'm doing a little bit of an opposing direction. I'm pushing this hip back into its socket, which is encouraging an external rotation, but I'm also stripping the sartorius and the more superficial quad in the opposite direction to try and encourage length. And now I'm just going to use my sharper side of my forearm. Being very cautious not to overwhelm her with pressure. All right. So now I can really feel the relationship between the top of her foot and this area of the quad right here. And it makes sense. This is probably the easiest connection. Whereas if we wanted to get a little bit higher into the stability of the adductors, we'd need to be able to access this arch a little more. So in order to get into the adductors and to this inner hip area, I'm actually going to apply pressure to the inside of the arch. And I'm just kind of stripping it. And her quad is responding because it realizes it's changing a neural pattern. And I'm just going to drive some pressure down and in to that crease for her. And take it to the other side. And from this position, I will show you a little more on the front of the calf, the front of the shin. I like to do a soft knuckle up these guys. It can be intense, but boy, it can be quite a relief. Generally speaking, it's a very unacknowledged area unless you have dealt with plantar fasciitis or shin splints. My least favorite. So now you can see we still have a little bit of a kick out on the right, but generally speaking, things look a lot more aligned. And I'm going to gently lift with soft fingers and lean back, creating just a subtle traction. And we are finished. Thanks, patrons, for tuning in with me today. I hope you enjoyed this video, and I will catch you next time.